Another one is called pincement. What we're going to actually do is we're actually grab, pinch. And this is if they want a little bit more stimulation. So especially if they have to go right back to work, you're going to ask them, kind of wake them up. Otherwise, you can do it at the same time. Also, this wakes them up too, just back and forth heat friction. Again, I'm going right over the spine or the sides, but not a lot of pressure. It's just enough to wake them up a little bit. And you can do, after that, you can just kind of more of a relaxing technique, especially straighten out the shirt. And this one person I was giving a chair massage to, when I was massaging her, she had a sweater on, and it actually started to peel a little bit. And I actually told her that it's kind of shedding a little bit, but she actually let me know that, oh, it's no big deal. But by the end of the 20 minutes I was massaging her, there was a whole bunch of sweater on the floor then. But just make sure you're aware of those kind of things. If somebody has a silk shirt, those work out really nice, just because you can actually glide on that a lot easier. So you can actually perform more gliding techniques, even like the figure 8, just like on the table. It's a little bit harder like this, but you can still perform it. Or you can actually just glide down. And with the chair, try not to be right in front of them like this. Maybe be off the side a little bit, just for obvious reasons. In the shoulder, you can get this area too. But with more gliding, you can actually just glide across, more like an ocean wave back and forth. And when you go on the other side, just make sure you still keep contact. So you don't want to go like this, do like a ballerina, go to the other side. So make sure again that you're having more contact when you're going around to the other side. Okay, with the gliding, you can actually have hand on top. And again, the back is centrally located, so you don't have to go one direction with the back. That's what's nice about it. So with the arms and legs, try to go more pressure towards the heart, less pressure away. But with the back, again, it's centrally located, so go whatever direction you want then. Okay, so also circular friction along the sides. You can also kind of squeeze the sides too. So remember, again, before we kind of squeeze, kind of pushing into the vertebrae a little bit, but now you can kind of squeeze the side of the body too. So you get more of the lats, external obliques. Okay, a nice one for pressure-wise, you're just going to lay your whole hand down here. Only pressure on the thumb area. Compress, push down, compress, push down. But this hand here, there's no pressure at all. This is the hand that's actually adding the pressure. And again, you want to actually use your body mechanics to get more pressure that way then. And you can even stay in area too. So if you're going to perform anything like trigger point therapy. And another word of advice too, you even want to ask them, do you have any bruises anywhere that I can't see that are covered by clothes? Also, any kind of surgeries. You might feel calcium deposits in the body, any lumps. Make sure you're not massaging them. But even just point it out afterwards, did you know you had this area down here? And the main thing is with that is just explain to them, if it ever gets bigger, have them get checked out by a doctor. Never say anything about cancer, of course. That's, the C word is a bad thing to say during massage, so just have them actually get it checked out by a doctor, any kind of things like that. And then the tips of your fingers, you can kind of circular friction. You can also both at the same time or opposite. Okay, with the shoulder region, you can kind of right on the scapula, the infraspinatus region, you can actually do circular friction right on there, because it's not as bony as the border over here though. So if they have rotator cuff problems, you name it, more circular friction. They can also interlock and compress, but just make sure your body mechanics down like this, compressing. And kind of lean in if you need more pressure then. So it's not you're leaning down like this. Make sure you're just kind of leaning your whole body, kind of like lunging. Okay, for the neck area, you can actually just pull their hair up a little bit. And if you need to, actually hold the headrest over here. And you can actually, as you can see here, I'm actually like circular friction right underneath the suboccipital ridge. Again, that's a big area for headaches. So make sure you're aware of that area. So it's actually called the suboccipital muscles. It's a group of 4, but that actually wraps around kind of like eyeglasses for the referral whenever somebody has kind of headaches. So, and I always ask permission whether it's okay to mess up their hair in a chair massage, especially if they have to go right back to work. So it all depends. So with the chair, when you're massaging, you can actually circular friction on the scalp. And if you want a little bit more pressure, actually hold on to the headrest. Go around. You can even go through the hair like this. Again, you can slow techniques down, speed them up. Everybody's going to be different. Okay, next one. Kind of squeeze. Or again, you can actually hold on and kind of squeeze. And some people actually will kind of fast circular friction. There's a treatment called Indian head massage, where for about 20 to 30 minutes, that's all they're concentrating on is head, neck, shoulder, scalp region. So they're actually using a lot of those techniques in these regions. Okay, so again, I always ask permission whether it's okay to actually mess up their hair or not. But some people will actually be basically shaved, and you can actually ask them, do you want me to use a little lotion on your scalp? So that usually feels good, but just always don't assume, always ask just to make sure then.